Terry Burks. I am a clinical therapist and author and CEO of Yearview Shima, LLC. If you would like to learn more about mental health issues, family and relationship issues, and off-topic subjects, go ahead and subscribe and hit the notification bell so that you will be in the know. All right, let's get into it. What do you know about sociopaths? Someone with sociopathy is unlikely to seek professional help or even realize they have ASPD. As a result, an important part of dealing and living with someone with ASPD is to know the process of getting them a diagnosis. Who needs a diagnosis? Well, children are usually not diagnosed with antisocial personality disorders because childhood development stages mimic some of these behaviors, and their personalities are continuously changing. If early warning signs are noticed in childhood, a conduct disorder may be diagnosed and an intervention may help. If a teenager exhibits uncontrolled symptoms, such as stealing, harming animals, constantly lying, destroying property for no reason, and breaking rules without thinking of consequences, they may be diagnosable. People who have a family history of personality disorders or those who have experienced abuse or neglect as children are more likely to develop sociopathy. Men are more likely than women to have sociopathy. Sociopaths are more likely to abuse their partners, spouses, and children. Since they may engage in criminal behavior, they are also more likely to spend time in prison, and their aggressive behavior can put them at risk or harm. They may have other mental health disorders like depression and anxiety. Here are some steps to a diagnosis. Well, what is a sociopath? People often confuse the terms sociopath and psychopath, or they use them interchangeably. They aren't different in the clinical sense. Both terms refer to people who have antisocial personality disorder, or ASPD. Those with ASPD have no regard for others' feelings or rights. They have lack of empathy and remorse for wrongdoing, and they have the need to exploit and manipulate others for personal gain. Nature and nurture play a role in ASPD. The reasons behind the disorder are not fully understood. The current belief is that psychopathy generally comes from genetic factors, such as parts of the brain not developing fully, while sociopathy results from an interruption in personality development by abuse or trauma in childhood. People often think that those with antisocial personality disorders are always criminals and easy to spot, but many are unaware of the disorder and they may never be diagnosed. Sociopaths have less consistent behavior than psychopaths. Psychopaths are more controlled and charming. Their manipulation is more detached and they plan ahead. Sociopaths experience anxiety and find rage. They may have a harder time blending in. Inconsistencies between their words and lives may be easier to see. Here are some signs of a sociopath. First, it's important to realize that people have many personality traits. Someone may exhibit selfishness or act aggressively, but it doesn't mean that they're a sociopath. Since many people who have ASPD don't recognize these traits as a problem, watching for consistent behavior patterns may be necessary. Consistent behavior patterns in sociopaths include the following: lack of empathy for others, impulsive behavior, attempting to control others with threats or aggression, using intelligence, charm, or charisma to manipulate others, not learning from mistakes or punishment, lying for personal gain, showing a tendency to physical violence and fights, generally superficial relationships, sometimes stealing or committing crimes, threatening suicide to manipulate without intention to act, sometimes abusing drugs or alcohol, trouble with responsibilities such as keeping a job, paying bills, etc. How do you deal with a sociopath? First thing you need to do is make sure they're a sociopath. The only way to do that is to get them an assessment. They need to speak to a medical professional who can refer them to a psychiatrist. Or if you have access to a psychiatrist, that would be the best bet. You may run into sociopaths every day and have no idea. What do you think? Do you think there are more male sociopaths than females? I don't know. I don't know if I agree with that. I think that there may be equal or it may be more female sociopaths that just know how to hide it well, or they're misdiagnosed because they're not seen as a threat. I don't know. Tell me what you think. Thank you for listening. Thank you for watching. Remember to subscribe, hit that notification bell. Until next time, be happy,